Hey everybody, Dr. Curtis Reynolds, the chiropractic physician here at Elite Integrated Medical Centers. And I've got a patient here for you that's going to show us how it's done here at Elite. All you do is hop on and ride the ride. That's the first step. Easy peasy. So this patient has been coming for a long time, so I pretty much know his spine pretty well. But we're going to feel for those misalignments. Have the patient take a deep breath in all the way out, and then little thrusts, no big deal. Patient is getting some good movements here, so that's good. All the way out. Good. Beautiful. Excellent. A lot of chiropractors miss this area up here, the T1, T2, T3 area. A lot of chiropractors miss that because I was a patient before too. And also, I have a lot of patients come to me and say, hey, the chiropractor I went to before doesn't check that area very well. So, lift your head up, just relax. Beautiful. Do that again. Relax. Beautiful. Excellent. All right. So I'm going to show you guys a different technique today. It's called drop table. A lot of people see the side posture adjustment online. This one is called drop table, so the table just pops up. So if you're worried about being twisted so much or anything like that, you can just get a gentle pop down with a drop table technique. So it can be very gentle, it's very safe, use it on lots of folks. All right, so we're also going to show you guys a side posture adjustment. Let's go this way today. So we cross the arms, hook the toe. Deep breath and all the way out. Good job. All right, on your back. All right, nice and easy, just relax. Beautiful. Beautiful. All right. Now, if this patient had osteoporosis or any other kind of bone weakening disease, I can easily use my activator instrument, which is 100% safe, can't cause any problems, it's not going to hurt anybody, and it can be used on little ones. I also adjust babies. My youngest patient was a day old, and my oldest patient was 94. So come on in and check me out and give me a try. You won't regret it. How do you feel?
Great.
Awesome.
Keep coming back.
Absolutely. Thanks.